As I went through my training in internal medicine and rotated through the various rotations, many of them were very interesting and compelling, but I think at the end of the day, the cardiology patients were a very rewarding group of people to work with, and that there were so many things you could offer them to try and help them, whether it's medication, sometimes with much improvement, or things to make their life better in some way. So that's the most gratifying rotation I was through, and I continue to love it. So it's a broad age range, young and old, male and female. They come generally with congestive heart failure, which is often problems breathing or with fluid retention as the main difficulties, or sometimes excessive fatigue is what brings people to us. Sometimes people come to see us for the first time, sometimes they're coming for a second opinion to have us review their treatment and see what other options can be offered. One of the concepts that we use in our group that has worked well, both with the heart failure and transplant group and in the cardio-oncology group, is that we have a lot of teamwork. And specifically in the heart failure group, we have meetings every day at 4 p.m. where all the inpatient services, as well as the nursing personnel and members of the surgical team, sit down every day at 4 o'clock and discuss the progress of each individual patient so that things are being taken care of efficiently, that everybody's on the same page, and I think it really greatly enhances things moving forward at an appropriate pace. One of the general things that I always find pleasurable is our heart transplant patients who have sort of exhausted all options for their heart failure and then go on to receive a heart transplant. It's very gratifying to see these patients continue to live many more years and watch grandchildren be born, watch their children get married, watch people graduate from college, and to watch them continue to have family experiences when it appeared that they were at the end of their life is wonderful, to have them come in with pictures of grandchildren and all. In the beginning, when you're just getting to know a patient, it's fairly direct in terms of taking care of them, but as time goes by and you start to learn about them and their families and their lives, you start to, I won't say become family, but you start to have a relationship that builds over time, and it's definitely one of the richest parts of medicine. It's wonderful to get to know patients and follow them over time.